recording now, and I will hand it over to Dr. Odell.
Awesome. Thank you so much, Dr. Johnson, for that really warm intro. I'm really excited to be here. Hopefully the professional nerd credential intro didn't scare you. I'm going to try to make it as practical as I can. There's also quite a lot to learn. And so I'm really thrilled to be here and share with you all today. And we'll get into intros here in a minute, just about, what I think this could be about for you as burgeoning school psychologists, to consider ACT as part of your practice. So what we're going to get into today, just to give you an overview, is we'll spend a little time on intros. And one thing that I'm trying to organize this around are maybe questions and things that I would be thinking about when I was kind of in your position in my training and early career. And I think I really would have wanted to know up front, like, why should I consider ACT? There's a lot of great stuff out there already. Why should I consider that? So we're going to spend a little time talking about that. And then after that, I'm going to introduce this concept around psychological flexibility, which are the key skills that ACT focuses on improving. And ACT was first developed for adults, and so it's really important as we talk about psychological flexibility. We're going to talk about it as the model that it is, and then we're going to talk about some more recent advances that are really specifically tailored to adaptations for youth, which are, of course, much of whom we work with. I think that's important. And we're going to leave a little time at the end to wrap up and just try to distill everything that we're soaking in. So I'm going to try hard to not kind of like fire hose you with information, and strike a pretty good balance. So we'll see how that goes. By the end of our time today, I hope that you'll be able to describe limitations to the current state of our evidence base for treatments for youth, especially when it comes to psychotherapy. And really, hopefully, that you can also describe what are the important factors to consider to promote, like, why would you want to promote psychological flexibility in youth? And we're going to also be able to talk about different functional classes of behavior that you're trying to shape and encourage and reinforce within youth, and how those map onto psychological flexibility skills. Another way of saying that would be a lot of the things that you're already doing are already part of what will really help to build psychological flexibility skills, and some of what's in ACT, I think, can even enhance that for you. Last but not least, trying to think about this in terms of your own practice. So by the end, you'll be able to identify some opportunities to develop your own clinical skills to promote psychological flexibility, both for your clients and for yourself. So for intros, what I'd like to do so we can get acquainted here is please type into the chat, and I'll read as we go. So type it in the chat, your position or affiliation. So like student, if you're already out in the workforce, that kind of a thing. And I know a lot of you are affiliated with the university, but just like to get a sense of who's with us today. So hold on, I gotta figure out how to turn on the chat. There we go. Now I can see it. So type away. And so, great. A lot of graduate students and one professor too. Okay. Excellent. Next question here. Now, what's meaningful to you about your work. Go ahead and type that into the chat. Why the heck are you students and professors? Do you have any idea? Well, I feel like there are some thoughtful replies coming. Yeah, make a positive difference. Sarah, I see that. Yeah, there you go. We got a bunch of helpers here. Look at that. Paying it forward, helping out. Right, yeah. And extending, yeah, kind of that reach of one person at a time to more of the professor. Hear ya. Next one, a challenge you're struggling with in your work is oh, I see you, Katrina. Confidence. Brave share, Hannah. Belonging. Lisa, I hear ya. And a big impact. It's really important. Haley wants to soak everything in, be a great practitioner, while still making it me as an individual. It's really cool to read that. It's so hard, I think, to balance out authenticity and trying to absorb everything and integrate it. Quit the journey. Jaylee just wants to be confident. Who doesn't? Oh, Zoe, another great share. It's really hard to trust in yourself, huh? I feel that too. Confidence, Sarah. Yeah. Did we get everyone we're close to? Okay. Deliberate effort. Stay in the present. Yep. ACT may be able to help you with that, Dr. Johnson. And just the other one here is what you hope you come away from today's training with. Some deeper knowledge, yeah. Hopefully I can deliver on that, Dr. Bedley. More knowledge, good. More tools for the tool belt. New knowledge. Some exposure to some new stuff, yeah, great. similarities across responses here. Nice. Thank you so much for sharing here. Oh, there's more. Deeper knowledge, more connections. You gotta keep it under some kind of theoretical framework too, to make it all more coherent too. I'm hearing that. Yeah. So tons of themes here where it seems like a lot of the responses are hanging together. So the questions are pretty intentional too, to orient us around ACT, because, and you'll see this as we go through the content for today, is that, you know, we're not here on accident. The work that we're doing is deeply personal, right? We're helping profession. There's a lot of other ways to make a living. This isn't like the easiest path to being able to be a helper either, right? And we all know that the systems that we work in to support youth, they don't function perfectly, right? So you have to really care a lot about this work to want to do it. And so there are challenges, right? And so this dance between the challenges that we experience moving towards what matters most to us in the profession, that's the kind of stuff that ACT is really designed to help out with. And so I'm also glad to hear that your expectations and what you're hoping to get out of the training are more knowledge-based, because in a 2-hour training around ACT, that's about what I can deliver on too, is giving you some info and some bite-sized experiences here. And if this sounds good to you, there'll be some other suggestions at the end for how to continue that learning journey for yourself. Now, going along with some of the limitations for an intro training like this, some suggestions for you, take notes. I will give slide handouts to Dr. Johnson at the end to distribute, but I can't get away from my school psych training about the importance of, you know, taking notes for yourself versus having the slide deck. I got to be authentic and do it that way for both our sake. Plus, like I was telling Dr. Johnson, I always tweak my slides right until like 1 minute before. So it's just not practical to ever do it. So maybe that's partly my excuse. I don't know. But thinking about this as you go, as you learn, like start thinking about it in terms of your practice too. I think that will help. And thinking about it, would it be wise to take any of this info and just try it with your next client? I just think it's reflective of you to be intentional about it. So there may be plenty of things that you learn or nothing that you feel ready to go and try. And we'll get into that confidence thing because that came up a lot as a barrier. And sometimes, you know, when I think of it, no one that's trying something new is competent, if that makes sense, right? The first time you try something, that's kind of the definition of that. No one's qualified the first time they try something. So thinking about, is this worth trying out, incorporating, using your judgment, because it's really hard if you wait until you feel confident before you try something. And at the end, like if there is anything that comes up naturally for you, commit to one thing to change your practice based on what you've learned today. I think that can help too, and making a training like this as useful as possible. I'll tell you a little bit about me and how I'm ending up in a place where I'm talking to you all today. So as Dr. Johnson mentioned, trained as a school psychologist, and I identify as one, even though I work in a non-traditional setting. So I was trained at Lehigh, and so tons of behavior therapy and CBT strategies, in addition to core school psych training. And, you know, I love that stuff, ate it up, it felt great. It really fit in a lot of my practica placements and schools. And when I got into some externships, but really on my internship and postdoc fellowship and clinical settings, in healthcare systems, what I was noticing is, I'm not saying I'm not blaming the the teaching methods or limitations of the techniques, but what I noticed in my skill set is that I didn't quite have enough to fully be effective with like a full caseload of clients, right? That weren't kind of hand selected the way sometimes practica placements are. And hopefully your practica aren't feeling like you're just getting thrown into the deep end, feeling like you're supposed to feel an internship, but maybe not as a grad student. That always happens to some degree. But what I noticed and what led me to looking into ACT in the first place was that I would sometimes get stuck in what felt like arguing with my clients. I'm not sure if you've ever felt that way, where you're like, why don't you get this? Like, I can see so clearly where you're stuck, but it seems like you don't. So when I was talking to a supervisor it was all the way into my postdoc fellowship when I was like, I don't know what to do. This keeps happening. I'm going to talk about it on supervision. And my supervisor gave me my first ACT book and said, try this out, right? And so I read it and I actually had a really terrible reaction to it. I was like, this isn't going to work. This is crazy. This is too heady, too complicated. Clients are never going to understand any of this. And my supervisor was a very good supervisor. They're like, yep, maybe you should try it though, right? Maybe up here doesn't have all the answers. You got to try it. So I did, and I'm glad that I did. Because it was a really great fit for me personally and professionally. And even more than ACT, I think what resonated with me was contextual behavioral science, because there were a lot of things that CBS as a way of being a scientist practitioner, it's just really helpful in integrating and synthesizing everything. Where school psychology is totally a discipline where you have to integrate and synthesize all the time. And so having a framework that really helps you do that, I think has been extremely positive for me in that way. And so as I progressed and started using it more in my own practice and as a supervisor, I started taking more trainings, I started doing trainings, really trying to spread around the love, spread around the value of all this. And it even made its way into a lot of my research. And so in my time at Geisinger Health System, there was research that we did. We developed a group treatment for adolescents that, again, it was like no inclusion criteria. Like, this is the ACT group for adolescents, because ACT's supposed to be able to handle, right, whatever. And it did. It actually, we're like very pleasantly surprised for a program evaluation study. We found out a lot of really cool things about it. And I've also been able to integrate CBS or ACT principles and psychological flexibility into other interdisciplinary research that's not about clinical treatments. So one is about, kind of technology-based targeted prevention, mental health platforms like online to be integrated in primary care, which has been really cool to do. And that progress study that's listed down at the bottom there, that one is about families that are coping with receiving genomic results that signal increased risk for adult onset conditions like hereditary cancer. So a lot of cool applications of ACT principles and psychological flexibility to be had. Now, I'm going to try to just frame out for you why I think it'd be a really good idea for you to consider ACT, although I feel from a little sheepish now, and maybe this is a place I can make up a little time from our technical flub at the beginning. I think I'm probably going to be preaching to the converted here, so I'll try not to preach too hard to you all. There are some things I think are important to think about. One is, I think the more that you learn about ACT, the more good news you'll find as a school psychologist, because you don't have to like, oh, you can only do ACT, you can't do anything that you learned before. Or like, if you're not doing ACT, you're not doing it the right way. I think that's the one of the most unhelpful traps and barriers to entry for learning more about ACT. So please don't feel like that has to be the case. It certainly does not. I don't think really anyone I've come across within ACBS as an organization even promotes anything close to that. I talked with Dr. Johnson enough to know that you all are getting really good behavior analysis training, right, already. Great consultation training already. You're learning different behavior therapy techniques and personalizing CBT techniques as well. I know last month you learned about MI, which, my goodness, I love MI so much. Please don't sleep on MI. You'll be glad that you kept going in that too. But the take home here is, like, you can take all this stuff with you, right? All the stuff that you are learning and working on, I think will play very nicely with ACT the more that you learn about it. And just a couple notes here, just about issues in the field, the way that it's grown up around psychotherapy research. So we want things that work, right? And I think evidence-based treatments, it's like we want to know what works all the time. But one of the disadvantages of that, like hyper focusing on internal validity and what works as a result of treatment, like that criterion isn't everything that matters, right? Because all the stuff that happens in a research context, who knows if that's going to work in the real world for your client sitting across from you that session. That's what you need to know. Any clinician really needs to know that. And that's why clinicians are always like, yeah, I don't really care about the p-value. Like, tell me what I can do with my next client, right? So all of that, kind of overemphasis on internal validity at the expense of clinical utility. I think we need to aim a little bit differently about that. There's also some issues around just the standards for like what works. It never got down to, you also need to be able to show how it works, and that's a huge limitation. So a couple quick ditties on that. One is the 500-year problem. Have you ever heard about this before? Is this new? No? Well, the 500-year problem would be, it's like an estimation of how long it would take. And this is the 97 citation down at the bottom. At the time, right, in the DSM, if you had all the resources to develop treatments, and you developed empirically supported treatments all the way to well-established for every single diagnosis in the DSM, that's how long it would take. That's a problem, because you need to help your next client. That's not workable. Another a kind of funny way of pointing out some problems around treatment development research and the limitations of not focusing on mechanism is called the purple hat therapy problem. So technically, right now, you could still, right, this is 97 and we're 2022. That's a long time. You could still do exposure therapy with a purple hat on and do all the steps, and it would be purple hat therapies and a well-established treatment. That's another problem, right? Because if you don't know why things are working, what the heck is the value? How is that an innovation, right? How does it help me more than doing exposure therapy? That's the question, right? And just in terms of overall, when they've looked at meta-analyses of psychotherapy for youth, there are also some concerning trends and stagnations. So it's not getting more effective over time, right? If you look at it that way. But if you take it all together, like 50, 60 years of treatment research for youth psychotherapy, best case scenario, it helps 2 out of 3 people compared to control. Like 2 out of 3 is good. Like if it's my kid and it's 2 out of 3, we're doing psychotherapy, right? I think most people would view it that way. But the fact that it's stagnating is an issue. The other thing that I think is even more important takeaway to be considering other innovations, ACT included, and just taking a different approach overall, is that if you see the statistic down there, like for anxiety, right, that is a pretty good effect size for anxiety. But multi-problem clients doesn't work. There are very few studies on multi-problem clients, and most clients that you'll see, check your experience on this, don't have just one problem. It's a little more complex than that. So that on average, things don't work is another way of saying that. And that's problematic. So we need ways to personalize and advance treatment overall. And that whole approach just leads to this vicious cycle, where treatments are developed, in a very disconnected way from where people are practicing. The outcome measurement, is forced into the resources of the trial, right? So it's pretty limited in that way. And then you don't really understand the mechanisms because that's not the contingencies of science. It's the outcome data, not the mechanism of change. And there's way more time and resources to figure that out. And so there's no big surprise that there's a real big limitation to the applicability of any of these findings and packages on real world settings, and you actually using it in the manualized way that you have to form it in order to get a grant. It's wild. So that's why the research practice gap it's not closing, it's getting bigger, right? Where it takes so long. And this is a vicious cycle. So another idea from contextual behavioral science, and one thing I really like about it and have appreciated is the folding in of evolution science principles. So one here that I'll share to kind of illustrate what do we do about vicious cycles and how might ACT help you with that in your practice is around this idea of adaptive peaks. So if point A is where we're at, like in the state of use psychotherapy, and B is some better version of that, we got to get from A to B. So vicious cycles, right, are self-sustaining, right? They keep going. Every point in a vicious cycle reinforces the whole process. Does that make sense? So if you want to break it, you have to put in effort, right? So it's very effortful to break those cycles. So the idea of an adaptive peak, you see the arrows kind of converging to keep you right at point A, right? That's what that vicious cycle set up to do. It's reinforcement of that cycle. So that's the bad news. You got to do a lot of work. The good news about breaking the cycle is you can disrupt it at any point, okay? So when you think about doing that, you can start from wherever you see an angle on disrupting that vicious cycle. Okay, so that's pretty good news. And once you work your way down enough, then you can start climbing that next higher peak, right? Where you want to be. And ideally, not that this is the way the figure is set up, but ultimately you want to see the peaks getting higher and higher as you go, right? Another reason to do this is that investment to get yourself in your own practice or the field writ large to a higher adaptive peak when it comes to use psychotherapy is that makes you more resilient, right? Because if you can transform a vicious cycle into a virtuous one, you get all the same benefits, right? So virtuous cycles are also self-reinforced maintaining loops. And if you get up there, that means other forces and influence that would take that down, you can buffer that out. But over a long enough period of time, right, it can wear you down. You can end up on a lower peak. But you can also use the same principles to figure that out, get back up to another peak, right? So before we get into contextual behavioral science and ACT, there's other things I think you should also be aware of and pay attention to if you're not already exposed to this or thinking seriously about it. One would be modular therapy. So if you've heard of that, if you've looked at, it's fallen right out of my brain. What is it called? The match ADTC protocols. Have you ever seen or heard about that? Anybody? I can only see a few, but no. Check it out. It's a really good other way of thinking about how to be more efficient and personalized. It's been really well researched, works quite well. Some issues for doing it in schools that are out there are those contextual factors that limit, whether or not those kind of innovations can make it into your real world practice. So we know that nothing gets done in schools without administrative buy-in. So it would take that. We know that school psychologist caseloads are really high. So that's not really conducive to individual psychotherapy. Know that often you're constrained into traditional roles, at least for a portion of your time. So that also is not going to include psychotherapy. And then there's really not a lot of training resources, right? Or there's kind of cost barriers to doing these things at scale. So really, those are the kind of factors in schools that maintain the status quo, even though the technology is out there, it could be useful. But if you get the opportunity to learn about it, or if now or in the near future, you will be on the job hunt, I think you want to be interviewing the places that you're going to work around things that will support you growing your practice over the span of your career. So don't forget about it that way. They're out there, right? You can find this stuff. Now, sorry if this is overwhelming figure. The only thing I really want to tell you about this from the healthcare setting is that how we think about therapy matters too, for whether or not we can do anything at the population level. So if you think about what kind of a metaphor for psychotherapy, everything that I've described before would be maybe something more like a product, right? So if we develop the manuals for empirically supported treatments, that's how we do it, right? It's a product, anyone can use it, that kind of a thing. I don't think that's a very helpful metaphor for therapy. I think what's at the center of this figure is more helpful, is that really what's going on in therapy is it's a co-created service. It literally doesn't exist before the conversation that you're having. And it's not just you, right? As a therapist, you can know as much as you want to know, you could recall it perfectly, you can do everything perfectly. It's partnership, right? So it's created in that moment. And so thinking about it more like what it is will help too. But then that's just, again, I heard some comments about why are we doing what we're doing? You want to have a bigger impact. So you have to think about it systemically if you want to have a bigger impact. So then you got to think about how that scales up to groups of individuals working together. And in a health system, it would be creating a system where there's loops between clinicians, patients, and researchers that promotes a virtuous cycle at that level. But then that's what can drive big population health outcomes for behavioral health and healthcare writ large. But what happens right now is not that, right? So you see maybe some repeating patterns here, that the same issues that have constrained progress and use psychotherapy are being made at the system level elsewhere, right? So all these self-limiting things that are happening, I take it as part of my job as a school psychologist to raise awareness around these things and to do what I can. Like, frankly, research is not the most fun part of my job. I don't know if you would say the same thing about that for yourself, but I think it's a really important part, because without it, you're not going to be able to have the tools that you need to be able to disrupt some of these patterns. And another thing I'll point you towards is the importance here that no matter what, no matter where you're working, no matter how much room you feel there is to make local or systemic changes, that you think about any endeavor that you undertake, act or otherwise, about growing your therapeutic skill set in terms of what is already known, because there really is a lot known on this topic. So the reference that I have down here would be a great starting point. If you haven't looked into any of this stuff before, really recent, synthesizes a ton of great info. You may have heard this talked about as like common factors. You ever heard that phrase before? That idea is like there are treatment specific and then there are common factors to psychotherapy. So like one way of thinking about it be the unique impact of ACT versus another form of cognitive behavior therapy. And that's how you might put them head to head. And the idea is like which one wins, which one's better based on the outcomes. But we've already covered that that's a silly way to think about it because you want it to work. You want to work with as many clients as possible. And maybe traditional CBT is perfect for client A, but ACT is perfect for client B. So that's a silly way of thinking about it. But what I think is a helpful way of even thinking about developing your clinical skills, because if we say common factors, it's like, oh, it's all the same, but it's actually not all the same. If you're learning how to do therapy, you know that, my goodness, there must be something someone should be teaching me here. So the way that this is organized in this book, I think is super helpful. I think it plays perfectly well with ACT, is that the foundation of everything that you do has to be centered around partnership and compassion for your psychotherapy to be useful. So the partnership orientation, like when you saw about my ACT journey, partnership was the reason I was fighting with my clients, right? And so in MI, I'm not sure if you heard this MI saying, but you're both wrestling and dancing are forms of working together, but they feel very different. Did you get that one, or is that new on you? Yeah. So the partnership piece is huge, but compassion is also huge because you can be right and unhelpful at the same time as a therapist or as a human. That's a Shawnism. That's the first maybe of many today. But you, just because you know what might help your client, if you don't have a compassionate context for that, you will fail, right? You will not reach them. So tapping into that caregiving motive will help you a lot. And you probably went through and did like OR skills and things like that last month. If you don't have that accurate empathy, you're toast, right? If you can't really understand and get that feedback from your client that you really understand their experience, right? How are you going to do the other skills that everyone always wants to hop into that are at the top of the pyramid? I mean, you can do them as techniques, but you're going to be really limited in the impact that they have for your clients. And then the other thing to think about when it comes to that is that there's both an experiential component, like inside of you, right? You're one half of that co-created service, but then there's what you express and the techniques of it, right? So all that's happening, right? And so again, these are really well validated, established, empirical findings. So hopefully I want to share that with you in the service of being able to think about that as you develop your entire skill set, and also as you think about how you might apply ACT. All right, so we're at a place where we can pivot into talking about psychological flexibility. Are there any questions or comments so far? Because I've been trying to make up time, so I've been going as quick as I could through that while still being useful. Keep letting it rip. Is that the signal I'm getting? Okay, I can do that. Now, ACT and CBS, we love our metaphors because all this stuff's so complex. Really need to be able to break stuff down to make it a little more bite-sized. So here's my attempt at that about how everything within CBS links together. Now, don't sign off the Zoom just because I'm talking about philosophy of science. But it's important that you hear at least a couple words from me about that, about functional contextualism. The important thing I think to communicate to you about that today is that there are certain goals of contextual behavioral science, or really any way of thinking about any therapeutic technology, even though they just might not be out there explicitly. It's really important though. So the goals for a functional contextualism is that we're going to orient everything that we do about truth and workability of our approach based on the goal in mind, right? So if you have different goals for different clients or anything, the strategies and the approach, right, the truth of what works can change. That's a pretty important distinction to make. But I think it's also one that, as a school psychologist, was like, yeah, that makes sense. Like, we're always trying to be really practical, really useful. So like thinking about it that way, I thought was very, very clarifying for me. But it's a big part of ACT and contextual behavioral science. Coming out of that is this, maybe you've heard of relational frame theory, maybe not, but it's within contextual behavioral science. It's a theory about language and cognition. It's got a lot of evidence behind it. Some really wild studies. I think I shared with Dr. Johnson one that as a school psychologist is like, can this be real? But they've done studies where they teach relational framing abilities, these relational abilities within RFT about how language and cognition work, and they raise people's IQ by 1 standard deviation. That's not supposed to be possible, right? That's like on the stone tablet of school psychology. You can't do that. But then there's these findings, right? So some really cool and interesting, thought-provoking, and maybe controversial findings, but things I think important to pay attention to when it comes to why it's important for a school psychologist to think about this stuff. So then from there, we get into the science of psychological flexibility, which we'll get into are the key skills, right? Things that we're trying to teach people to improve their life. But then there are a lot of different technologies for doing that. So one, I gotta change my orientation because now your faces are over my slide. So Act 1, we're here to talk about ACT. There are also a lot of different ways of doing ACT. So we're not going to talk about these two today, but there's ACT Matrix, which is really cool. And we've done trainings before for school psychologists on ACT Matrix. It could be very useful. FACT is called Focus ACT, and that's one that was developed to be really brief and potent for things like primary care settings. That would be a cool one for you to check out too at some point if any of this resonates with you. Now, there are some others that target psychological flexibility, that don't directly come straight from ACT. So DNAV is one, and we will go through DNAV because it's one of the youth-specific psychological flexibility interventions. Prosocial is another one that's for group behavior. So when you're getting into all my crazy graphics about population behavioral health, that you can apply a lot of these same principles that are applied within an individual or two individuals with ACT at the group level. And so that's a pretty important thing to know, that there are technologies developing around that too. And all of this is framed within contextual behavioral science, right? And so the goals there, when you think about all of it, is you want to develop new ideas and methods that are the most potent you can possibly find, that are targeting these processes of change that you can actually change, right? So psychological flexibility is important, and it belongs in contextual behavioral science precisely because you can change these things, right? And we want to be able to have, I think I said the most precision, but you also want it to have broad scope, right? So you don't have to, ACT isn't just for your client, it's for you. It applies everywhere that human beings go and everything they do. That's the point, right? And it has to have a lot of depth to it as well, right? So it can't just work on the level of people talking to each other, but then doesn't actually work that way when you look at it at a neuropsych level, biological systems on down. Like it all has to agree with itself. All right, that's a lot. There's not going to be another slide like that one. There's a lot you could read about this too, right? So I included that. Now, probably the most important thing I could tell you to think about when it comes to what psychological flexibility is to talk about the opposite. Like the reason this technology exists is around psychological inflexibility, which causes huge problems for people. And so you gave me info about what matters to you and the challenges that you face in your practice. So check your experience. Is this how it works for you? The more that you try to progress in your skill set, the more challenges that you face, right? The more confidence issues you might face, for example. And so that's like the red gooey thing there. And what's the natural thing that we do when we come into contact with that? Well, we want that to go away, right? And so as you move towards what matters to you, that stuff tends to show up more. But for all the reasons that we're going to talk about later, it's really easy to get caught up in that, not keep going, but actually go back towards your comfort zone, right? So that pattern is what ACT is designed to disrupt primarily, okay? Psychological flexibility doesn't say, okay, we're going to solve the problem of your pain or your uncertainty or self-doubt or confidence gap or whatever, right? We're got to get rid of that first, and then you can live the life that you want and keep moving towards what matters. It's like, no, we got to find a way to put it in the backpack and take it with you. That psychological flexibility. So it's important because if these patterns of behavior, like on the scales of that, tend to tip more towards experiential avoidance for you or for your clients, that's associated with a whole bunch of negative outcomes across a very broad variety of domains. And the converse is also true, right? When folks have higher psychological flexibility in what they do, psychopathology tends to be low, quality of life tends to be a lot better, right? A lot of broad domains, education, relationship, health, like fitness, all of these things are much higher because this really gets at what is hard to be effective and build patterns of healthy action, right? Is the things that tend to stop us, a lot of them are psychological barriers. That's what psychological flexibility is about. And another thing that I think is really crucial to think about when it comes to the depth of contextual behavioral science is that the change that you're trying to achieve, it works really differently depending on the level of analysis that you're at. So I've got to change my orientation one more time so I can see. One dimension is that as you go from more foundational systems to more advanced and evolved systems, is that the change that can happen happens much quicker, right? So genes change very, very slowly. You know, one way in evolution science that they talk about it is that behavior and environment are, you know, in a very stable environment, very consistently over time, it turns into biology, right? But it takes a very long time for that to happen. And behavior doesn't fossilize, so it's very difficult to tell like how all that happened, but we do learn and progress. And epigenes, this might be a new word for you, but there are things within us that react to our experiences that modulate gene expression, right? It doesn't actually change what your genes are, but it modulates their expression. And that has upstream implications on your biological systems. And then we get into things that we're probably really familiar with, which is behavioral learning, right? So whether that be SR conditioning, operant conditioning, observational learning. Like now we're finally back in like solid footing. We understand these principles and how to influence them. And what I think ACT and RFT help with is the most human characteristic form of learning about language, symbolic relations, right? So if you think about it in that way, like we're doing it right now. And if you think about it, it's not even, I'm not there, right? So this is my voice going digitally into my AirPods through the internet, coming back out, to you and moving air, and somehow we understand this. That's pretty wild when you think about it. But the other thing to think about is that when there are really big problems at lower levels, things don't go well. Like if there are major genetic issues for an organism, that organism does not survive, right? That's just the end. But what about really bad ideas? Like we don't melt into a puddle. So that is good in a way, but it also means that we can do things really quickly, insensitive to what else is going on around us, that we can miss all that feedback and we can just make our lives much, much worse. And so another way of saying it's like all of this goes together, and human beings are basically like a race car with no brakes. And so psychological flexibility is a way of like finding the brakes, the steering wheel, maybe having an instrument panel or whatever you're doing, right? All this is really important because we didn't ask to be in these bodies. There is no complete owner's manual of how everything works, unfortunately. And the way that we learn is actually we're kind of like writing the instruction manual as we develop, right? And your role as a school psychologist is to try to be really effective in preventing, teaching, reinforcing things that are going to lead to success for people. So the more that you can learn about these things, I think will be better for you. You can, by the way, chime in anytime if there are questions that you want, or just throw it in the chat. That's fine too. Otherwise, I'll just keep going. So now what you'll see me do is we're going to go through and talk about psychological flexibility in more and more detail. So we've been talking about it as one thing, but you can also break it into two things, right? So the two things would be thinking about it as mindfulness skills and behavior change skills. So again, to bring this home for you as school psychologists, you got tons of behavior change skills. That's so good. That's so good. And the mindfulness skills can really enhance a lot about the psychological barriers and how to overcome them, both for yourself, for your clients, for really anywhere that you see an opportunity to promote healthy patterns of behavior. You can break down the mindfulness skills into a couple of domains too, right? And so mindful presence, that was one thing I think that Dr. Johnson was saying. She wants to develop more mindful presence around things. So I can help with that. But the emotional openness piece is another huge part, right? Of the mindfulness skills that's not always found in traditional mindfulness practice. So it's a little bit unique to ACT in that way. And behavior change in ACT is really defined as doing what matters, is a really important construct, right? So we want to think about effective action, and maybe like you can see a connection back to that wild slide with the house, right? So it's all based on the goals. So whatever, an individual decides is important, right? Are we making progress towards what's important? That's doing what matters, okay? So it's not just one right way of doing things. It can be very relative to individuals or even situations. But then when we get all the way down, like all the psychological flexibility skills and their counterparts, there are 6 of them in the ACT model. So you have the present moment awareness. You also have issues around the self and how we relate to ourselves and others as part of the being present domain. Acceptance, like the emotional openness and accepting difficult private experiences that come up, is a huge skill set in itself. It's one of the most difficult ones for people. Diffusion, okay, we're going to talk more about diffusion, but language can be very sticky, right? And it can trick us in many ways into doing things that trade off longer term doing what matters kind of stuff for short-term relief, right? Going back to that psychological flexibility slide where the guys walk in towards what matters, and then difficult stuff comes up and walk it right away, right? That's the emotional or experiential avoidance part of things. But then you can, within the psychological flexibility model, you also can break it down, the doing what matters, into values and committed action. So again, we're going to go more into that, but values are more like what you're choosing as a quality of action, right? Not necessarily what it looks like on the outside of what you're doing, but then actually taking steps, right? Have you ever been in a situation where you're like, oh, I've decided that I'm going to do this? MI probably talks a lot about this too, when you're looking at change talk. Like, who cares about the talk, right? You have to actually do something. So you don't stop in MI at just getting more change talk. You try to get a commitment, right? So a committed action. And when people say that I'm doing this, right? In MI, it tends to be a strong predictor of if they're actually going to do it. And if you see a change talk go up, but you don't get the commitment, it's not bad, right? But it just means that it's less likely that someone's actually going to do something before the next time you see them, right? Okay, well, let's try something here. We gotta actually see kids in action. You know about the marshmallow test? Have you ever seen or heard about that? Yeah. Okay. We're gonna break up the information parade here. We're gonna see what it looks like in young kids to try to be psychologically flexible. Please, someone signal to me if when I start playing this, you can't hear it. All right.
Okay, sit in that chair. All right, here's the deal. Marshmallow for you. You can either wait, and I'll give you another one if you wait, or you can eat it now. When I come back, I'll give you another one, so then you'll have two. But stay in here and stay in the chair till I come back, okay? All right. I'm gonna go do something and then I'll come back.
It smells yummy. It smells really good.
So it's up to you. You can have it now or you can wait. Okay? I'll be back. Stay in the chair, okay? Okay.
You can see what they're going through, yeah. So they get this contingency laid out. You can have it now, but if you wait, you can have more, like double or two. And there's no adult around to stop this from going down, right? So a lot of discomfort to wait because you want to eat it, right? The immediate gratification piece, huge, 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 huge. Eating it now instead of engaging in strategies to hold off, this is effortful, isn't it? Right? So when it comes down to things at this developmental level, you know, this shows up everywhere. How many of the problems that you're called in to help with are essentially about things that really are aversive for adults? You know, it's like, fix this kid's behavior. Like it's an oil change. Okay, yeah, I'll give them back to you. We all fixed up. It's not how it works. But when you think about these skills that are developing and emerging, it really is about the ability to withhold and inhibit what would give you immediate gratification in the service of what will help you and other people long term, right? That's another way of thinking about psychological flexibility and what we're doing and why. So again, just to reiterate, you know, you can get mentally stuck on things, everyone does. And a lot of what will make it harder or more stuck is when we don't exhibit emotional openness, especially in distress, can't tolerate distress, can't open up to it. And we spend a whole lot of time and effort and energy trying to change what's going on inside. Like, isn't it the case that the normal human emotion for those kids left alone with one marshmallow and really wanting to, isn't that stressful? Like, isn't that the normal human thing to go through? It just makes sense that it's happening, right? Why would, you know, very difficult for them to be able to stand it. But the avoidance piece can be the other side of what really causes problems, right? And so the other thing about reinforcement that's important to remember is that your behavioral repertoire narrows when things are reinforced. Don't forget about that, right? So if it's reinforcing for shorter term contingencies, that naturally limits what you open up to in terms of long-term contingencies. And so that's much more common and developmentally appropriate the younger someone is, right? But you want to help them open up and you want to help yourself open up. So the behavioral avoidance, that's another thing to really be looking out for and actually helps to target that. Oh yeah, yeah. And the sand. Not think about that. Let's not think about the purple hat therapy problem either. Let's just not think about that. So the dynamic that can develop here, right, is that the same strategies that work short term end up causing long-term problems, right? So you may have heard it said, you know, colloquially as like short-term gain, long-term pain, right? Or digging yourself into a hole as a way of solving the problem of getting out of the hole. Like, it just doesn't work. Like, the more that you use that strategy, the worse it gets. And so experiential avoidance is a lot like that. Okay, now we're building up the complexity, right? From now we had 1, we had 2, now we have 3, the Triflex. So Russ Harris is the guy that it used to be the 6, right? And I'm trying to go in the opposite order because 6 is overwhelming. But hopefully this is helping a little bit. But if you bring into 3 skills, remember, it's be present, open up, do what matters. But in the presence are those 2 skills within the 6 skill Hexaflex. And so your mindful presence, right, is really important because it overarches the other two things. How
Is it Dr. Odell that just froze? Can everybody hear me?
I can hear you, Dr. Johnson. Can you hear me?
Yeah. Okay, let's see if we can get him to unfreeze for just a second. And I'm going to pause the recording. Well, actually, I'm not. Okay. He's probably going to come back into the waiting room. Okay, so he just emailed me and he said randomly his entire power went out. And it just came back on, so everything has to reset, so he's coming back. There he is. I think.
okay, can you hear me?
There we go.
Oh yeah. I was going through that and it like every light was like off, gone. Like, okay, well, I'll try to be a better presenter next time. You don't have to turn all the lights off. Geez, Dr. Johnson. Okay, are we seeing the slide deck again?
Yes.
Yes. Okay, cool. The openness skills, I think, is where I was about to leave off when electricity so rudely interrupted me. And doing what matters, like being present. Oh no, that's where I was. Being present overarches both, I think, is what I was saying. And so if that makes sense to you, like how could you pick what doing what matters would look like if you're not present with what's going on in the moment and really clear on, you know, your relationship between self and other people? It just doesn't make sense, right? Same thing with opening up. Like, why would you want to open up if you weren't connected to that, or you might miss that? So they kind of all work together, and breaking them down into their component parts, you know, try to, again, think about it in terms of that overarching workability based on the goals way of thinking about it in ACT. All right, now we're to the baddie, we're to the Hexaflex model. So hang in there with me. We're going to illustrate a little bit about these concepts. And so one of the ways that I think is the best way in, just initially, and I'm not going to go through and explain every single construct and the technical definitions. I'm going to introduce it in terms of what's called the ACT question, right? So starting down with self as context, right? The way of putting this in a question that links them all together is any situation, any goal that you have, right? Anything that you're struggling with, given the distinction between you and the stuff you're struggling with, it's an important distinction, between the stuff you're struggling with and trying to change, now over to acceptance, are you willing to have that stuff fully and without needless defense, right? As it is and not what it says it is, right? The difference between, you know, your thoughts as thoughts, nothing more, nothing less than that. Also not forgetting that they're thoughts and not capital T truth about how the world really is. And do what takes you in the direction of your chosen values at this time and in this situation. Right, so that ACT question is another way of saying, like, being psychologically flexible in any scenario is a decision about what to do that you can only make in the present moment. We can't make choices in the past or future, right? It's always now. And how that works, right? What would be a psychologically flexible choice when the going gets tough? It takes all of the skills at once, not just any one of them, right? It takes everything together. And so if you think about that and the willingness around it, it's really important to think about it as a whole as well. All right, now I think we're actually to a point where we should probably make a decision because we have about 40 minutes left total, if I'm tracking right. Am I right about that? We have until the top of the hour. So we have the developmentally appropriate or developmental adaptations to ACT to go through, and a little more content. We haven't done much that's experiential. We haven't had many questions so far, which again is fine. But I want to make sure that I tailor the time that we have left for what would be most useful for you all. So any strong feelings one way or the other about more info, keep downloading info versus let's pause and see what it would look like in a real play demonstration or anything like that. I'm fine with anything. Just want to make it the most useful for you all.
I had an item of clarification on your previous slide.
Sure, go for it.
So is each one that are numbered, so number 2, are you willing to have that stuff fully and without needless defense? Is that considered acceptance?
Yes.
Then,
yeah, I tried to put them as close as I could to the.
I just wanted to make
to the
sure
skill.
that was making the connections with the students.
Sure.
So,
I mean, that's a really good one. Acceptance is easily misunderstood because it can come off like, oh, well, I have to like that I'm feeling anxious, right? Or I have to just be okay with them. I feel like crap and I'm never gonna, like, it's not a passive resigning yourself to things feeling crappy. It's not what acceptance is. It's a really active choice about willingness, okay? And willingness is either yes or no, right? You're either willing or you're not, that's it. But what you can change is like, how willing can you be? Like, I'm willing to do this, but not that, right? I'm willing to feel the anxiety that I would feel if I said hi to someone, to the cashier at the grocery store. Like, I'm willing to do that. I am not willing to say yes to presenting to you all. No, too much anxiety for me, right? Not willing to do that. So it's, can you willingness to have all of it fully and without needless defense? That's the kind of active process of acceptance that ACT is trying to orient people towards. Is that a helpful clarification?
yeah, I think
cool.
it's super helpful as you go through this model and someone is presenting or you're presenting with something. of you being able to ask yourself the kinds of questions or of the client and where they are
Yes.
in their flexibility.
Mhm. Yeah, and another thing I might say, just riffing off that, would be, if you think about it this way, and if you think about that question for yourself or a client, you might start to see, the more time you spend with the model, where they might be stuck in any given point in time, like which place or places might be the big stuck points. One of the most useful examples of like, how do you do ACT, because it can feel very, even with 6 processes, can feel really overwhelming to try to have the working memory to be thinking about all of this at the same time. And I would just think about it, this is another metaphor, but think about it in terms of getting a cork out of a wine bottle. Is it, you're gonna like move it all around, right, to try to get it loose. And so if you're like, oh my God, my client is so emotionally closed off, they're so avoidant to their own experience, I got to work on getting them to be more accepting, that would not be the way that's probably going to be most useful. Be like, acceptance isn't there, but what if it was something really important to them, right? Then maybe the willingness would improve, right? If it was really important to them, or if you could add in other contingencies to kind of sweeten the deal, right? So you see how that might work, is like, if you're stuck in one part, or your client stuck in one part, that doesn't mean that you want to actively target that per se. You want to think about like, what is the situation offering me? What's my client's behavior signaling, right? So if trying again to make that connection with MI is, did you talk about the idea of change talk and what you're listening for as a practitioner? What you're going to reinforce? Yes, no, maybe. I don't want to keep going with this if that's foreign from last month.
No, that's not foreign.
Okay, that's okay. So if you think about when you're putting something out, like a question, and your client in MI would be saying something back to you, and if it's change talk, you want to reinforce that, right? But you're listening and you're making that discrimination as the therapist, like, is this change talk or sustained talk? And you're going to differentially reinforce the change talk. Same thing here, but maybe you're sorting it into flexible, inflexible, and you're thinking about ways that you can reinforce or promote these different processes. So if you're hearing inflexibility in the acceptance domain, since we were talking about that one, you can reinforce or open up other areas, if that makes sense. Did that help too? Or muddy the waters?
No, I think that gives good context.
Cool. Any other questions or thoughts about the model so far? Okay. Well, I guess without any other strong feelings, I'll go in through and we'll talk about developmental adaptations here in different psychological flexibility models for youth. So I'll have to gloss over, I think for time, honestly, some of my favorite content personally, but it's not about me, it's about you. So here we go. We gotta skip that. One thing that I will spend time on here around motivation. So Steve Hayes has a book that came out not too long ago. He's one of the originators of ACT, and it's called The Liberated Mind. But he frames it out. I haven't heard anyone do this before in ACT. I thought it was super useful. You take the same ACT question, but you can connect intrinsic motivation that, pretty universal to humans. and connect them to the different processes. So if you think about what's going on with acceptance, and again, we'll pick on acceptance because we were just talking about it, is that's connected, right? Your acceptance skills are connected to your intrinsic motivation as a human being to feel and experience things. But it's also very human to not want to feel and experience aversive things. And that can sometimes cause problems for us, right? But if you think about the other domains too, and this really helps a lot when you're listening to your client and figuring out what might be a way in to help out, is, we can get, we'll go down to diffusion, because that's another one that can get very tricky as you're first learning of that act, is that, why does language and problem solving, why does that dominate? Well, it's because we have this really strong need for coherence and understanding. Things need to make sense. When things don't make sense, we go crazy, right? We just go crazy when we can't figure stuff out. So it makes sense that the problem solving mind will kind of dominate. You could go to any one of these things, say, like, when I feel disoriented, for attention to the present moment, like, that's a reason, right? That's intrinsic. Everyone needs to feel oriented, like they understand where they are. You could go the self, belonging and connection. Who doesn't need that? You see where I'm going with this? Like, there are these intrinsic motivators connected to all these properties, and you can see why problems in any of these areas would crop up. But all the same energy that would lead someone to be experientially avoidant or psychologically inflexible is just the other side of the coin, right? If someone's in a lot of pain around being, or we talk about this in school psychology, right? Being a rejected or neglected peer, right? Wouldn't we target that maybe? But that's connected to people's sense of self. That's connected to something very intrinsic, to belong and be connected. So thinking about ways in with your clients, I think this can help too. So I hope it's helpful for you to think about these overarching motivators. I'll skip that one. The Kidflex. And this is like really new. This book just came out within the last few months. Tamar Black is the author. So her adaptation to the Hexaflex is called the Kidflex, unsurprisingly. But what you notice here, what I guess I want to orient you to, that I think is really useful about the Kidflex, is that in the middle, right, I am flexible. We haven't really seen anything like this up to this point about psychological flexibility, where if you look at all of the points on the Hexaflex, now they're actually instructions, right? Kids, when they're younger, if you get all heady with them, that's what I was reacting to when I was when I was a fellow. Like, oh, no one's gonna ever understand this, can't do this with my clients. Well, there's some truth to that. If you sit down and try to explain that distinction about acceptance to a 7-year-old, can you imagine yourself thinking that's a good idea? I can't. But what about let it be, right? Could you imagine instructing a kid that's 7-year-old, let it be, let the sadness be? Would they understand that? I think so, So this way of saying it, right? Let it go. Let that stuck thought go. Just let go, right? Isn't there like a song in a movie about let it go that is helpful for this? I think. I don't know, something like that. But so that's one thing I really appreciate about the way that Tamar Black has framed out the Kidflex here. It's concrete enough for younger kids. It's instructive, right? You don't have to have both sides of the Hexaflex for it to make sense. It's just like, stay here, right? You're off thinking about the scary future or the horrible past. Like, okay, now come back to class, right? Another one that I think is really interesting, maybe worth checking out. Now, this one is targeting psychological flexibility. It's called the DNAV model, but you'll notice that now we're totally away from the Hexaflex, right? So the thing that I think is important for you to know is that, and hopefully this can be a connection point to other things that you already know and can integrate psychological flexibility into what you're already doing, maybe amplify, excuse me, the impact of what you're already doing. Get a little technical for a second. DN, A, and V are functional classes of behavior. Are you familiar with that technical term about functional classes? Behaviors that can look different topographically, but hang together functionally is a functional class. So discoverer skills are like your trial and error learning. It's a functional class of learning from your experience. That makes sense. You see some of the examples there. Noticer, that's another way of kind of like talking about mindfulness, but it's a functional class about noticing what's going on in the present moment, inside and outside, right? Kind of a cool way of putting it, I think. Advisor is a functional class around like advice you give yourself for how to behave. Another way of saying, you know, rule govern behavior, right? So it's cool that way. Values and how it develops. The reason it's like a small v in DNAV model, this is an important thing to know too. Like values are developmental as well. So in this model, you know, they talk about values. They call them proto values in this model as a way of saying that they're developing. And so that's one of the reasons why I think, you know, I wanted to have that slide around intrinsic motivation there, because what's one way, this is one way that I think you can, you know, start to look for this in your clients, start to think about, you know, how you can start to understand what these proto values might be. Like if you ask a kid, what would they do with their free time? You're like doing preference assessment, you do these things because there's something intrinsically motivating about that. But not every kid has the same intrinsically motivating activities. But if you look for what are the qualities inside video games, you might find a proto value, right? Maybe it's the online social connection. Maybe it's like the quest, like role-playing games, right? There's something inside that for that kid. Does that make sense? Or like I like, you know, competition in sports. That's what I like to do, right? So you can start to look for what kids are intrinsically motivated to do, to start to understand what their values might be, and you can start to look for those same qualities other places or connect them to difficult stuck points in education. You see the implications of thinking about values as developmental in that way. So I think that's a cool thing to point out about DNAV. And then you don't have to explain the Hexaflex, so there's that too. So you might just want DNAV for that reason. Let's see what we're doing. I think that we do have time for this activity. So we're going to watch a 5-minute video. It's like a video around DNAV. And the first time that we go through, I want you to start honing your ACT ears with one of these acronyms. So I put them up here because, again, this is a lot to try to soak in at once. So some acronyms can be helpful. Although as school psychologists in training or in practice, I know you know the alphabet soup is not always helpful, but hopefully these acronyms are helpful for you. So let's go through with private experiences first. So if you're taking notes, take this down so you can be thinking of these different categories of private experiences as you're watching the video. And so every time you notice something in the video that falls into the category, I want you to try to make a note of that and see how many different thoughts, emotions, associations might be counterintuitive. It'd be like, well, it's like metaphor similes. So if someone said, depression is like a weight around my neck, that'd be an association. Does that make sense? Or school is the devil, right? That's an association. If there's content that comes up that's around, seems like it's about a memory, jot that down. If you hear any language or signaling around physical sensations, write that down. Any points for clarification on that? Okay, give me a second to switch windows. Does everyone, well, if you didn't get enough time to write down the acronym, let me know now before I take the slide down. Does anyone need more time? Okay. All right, again, someone stop me if you can't hear this once it's playing. We're gonna watch this about 5 minutes. Just try to track and sort everything in Teams that you can.
Dr. Odell, we can't see the video, nor can we hear the video. And you're on mute.
All the problems at once. There we go. When did that happen the whole time?
Yeah.
Oh my God. Okay. Let's see if we can get that sorted. Oh, and you're trying to show me in the chat. I couldn't see the chat either. Okay, let's try that one more time. All right, you can see
Yes.
Just now? Okay.
I hate school.
And could you hear that?
Correct.
All right, let me try to scale it here. Okay, it's still working. Sorry. If it goes weird again, just start yelling at me.
Do you hate school too?
There are lots of reasons to hate school. Maybe you find it really hard to get out of bed. Maybe you don't like the work. Maybe you get bullied. Or maybe it's just boring. This video is about some things you can do to help yourself. Of course, this video won't help you turn school into a wonderland with rainbows and unicorns. And we won't be telling you that you must go to school. That isn't our job. We'll just be showing you how to use your DNA to work through hard stuff so you can get more of what you care about. We're not talking about your genetic DNA. We're talking about some skills you have as a human being. Your discoverer is the skill that helps you do things and explore. Your noticer is the skill that helps you be aware of what's going on around you and inside you. And your advisor is the skill of talking to yourself, giving yourself advice about what to do and how to fix problems. The V? Well, that stands for what you care about. We call it value. We use our D, N, and A skills to get more V, value. Let's begin with V. That's what's in your heart, what you really care about.
I've been making a list of what I value about school, and it isn't math. Can I do that with my DNA and V?
Yes. Once you learn to harness the strength in your DNA, you'll soon discover it can help you with all sorts of things. Let's start with mornings. Everybody hates them. Your noticer tunes into feelings and sensations.
I'm so tired. Please, I need to sleep. I feel sick.
Does your noticer do this in the mornings too? When you get stuck inside those tired feelings? Bam! Your advisor arrives and tries to figure things out.
Ugh, school again. Everyone is smarter than me. It's so boring. There's no point in going. I'll just fail.
Your advisor's job is to work out why you feel so bad when you have to go to school. And the discoverer's job is to do things, to try things out.
Hey, just go back to sleep. They can't drag you.
Sometimes, hours later, your advisor does something different. It gets really mean.
You're an idiot. Why didn't you just go? Everyone in school knows you're a loser. Now you'll never get a job.
And then your noticer reports in.
This feels weird. I hate these feelings. This doesn't feel easier anymore, the way it did this morning going back to sleep.
When you end up in this place, ask yourself,
Have I used my DNA to help me get what I really want?
probably not. Let's start again, here, as you go to bed. First, consider some of the things that matter to you. Your values, your V.
I want to have friends. I want to get the life that I want.
Now you can call on your discoverer. Try to think of one small action that will help you with the things you really value.
Tomorrow I could play basketball with friends at lunch.
Morning arrives, and maybe your noticer wakes up with,
I'm too tired to go.
and your advisor starts up with,
It's so boring. They shouldn't make me do this.
instead of tuning in to what they are saying, remember to use your discoverer to do something, anything that will take you toward what you value. Take that first step. Just put one foot out of the bed, and then the other. Move in the direction you want to go, and just carry your advisor and noticer with you. After all, they're not really awake yet. As you go, remind yourself that you can use your DNA skills to get what you want. And eventually, you'll find you are working toward what you care about. You're playing basketball with your friends, and you're also working toward the life you really want. I wonder what his DNA messages would be telling him now. Remember, learning to use your discoverer, noticer, and advisor flexibly helps you, not just with mornings, but with other things you want. Your DNA skills help you build your life your way.
Well, hold on a sec. There we go. Sorry, I lost my Zoom window. Are the slides back? Wow, amazing. Any reflections about the DNA video or sorting stuff into the Teams acronym? There's a lot of Teams flying around for that kid.
There was one part where he was, I think it was like when he was first waking up, he said, I'm so tired, I feel sick, which I guess could kind of be like the sensation or.
Yep. Yeah, so definitely in a thought and also signaling something about sensations. Great noticing and sorting. Any others that really stood out or felt hard to sort?
After he didn't go to school, he said he felt like a failure. And so I thought maybe that would be an emotion and a thought too.
Yeah, so I can see how, certainly a thought because it has language around it, and feeling, right? You feel like a failure, right? You use the feeling word, so emotion. Totally get that. And I can also see maybe like an association, like me equals failure because of not going to school. Maybe an association there too. And that's also something that people do a lot, right? Is say, I feel, but then what they end up expressing is not an emotion, right? So failure is not technically an emotion, but what emotions might go along with feeling like a failure, like saying it that way? Can you think of any emotion words? Real question for you all that might go along and hang along with failure? What kind of emotions tend to hang around failure?
Anxiety.
Yeah, could be, totally.
Guilt.
Guilt, sure. Guilt being like, I let other people down by this failure, maybe. Yeah. Any others that come up? So all good ones, right? This is a good thing to think about too, trying to connect some dots. So with that association, like I am, right, or equal sign failure in the Hexaflex model or whatever, right? We're thinking about issues of the self, right? Because I just said I'm a failure. Other emotions, other really painful emotions, judging, criticizing yourself, right? Anxiety's one, guilt's one, like I didn't do good enough, right? But there's also shame and embarrassment, right? There's something wrong or bad about me, like it actually is me that's the problem, right? And that can get extremely painful for people, right? There's another one to be thinking about whenever you hear self-criticism, self-attacking, thinking about shame too. Cool. Well, maybe it'd be best to kind of move on to wrapping up, given time. I don't have a hard stop at 3. I don't know if you all do. Maybe you do. Do you all have hard stops at 3? Or just it's Friday, so, right? Got Friday stuff to do. Anyway, so just a few bits of general advice and some guidance on resources for you. A lot of, what I hope came through too, and I think is not news to you probably in what you do. As kids get older, what you're trying to do is help them develop more complex chains of behavior that help them do more, right? Across time. And so when you're thinking of that, try to think of shaping as a key part of doing ACT and just like improving your practice, because there may be like the skill that you hope that they can perform consistently down the line. But when you're thinking about shaping, you can think about, okay, what can they do independently right now? And you can start like teaching and reinforcing just beyond that, because that's how you get them down the line. You can think about all of this in terms of, DNAV, Kidflex, Triflex, Hexaflex. Like you can think about it any way that you want. But for me, again, very helpful to think about it as one of the things that I'm doing as an overarching strategy is shaping more skillful behavior and trying to then get that to be independent, things that we're doing anyway. But you can apply that here as well. Another thing that was a really powerful improvement to my practice is when I started thinking about that variability, like behavioral variability. You can think of that as an operant too. So you can just reinforce variability in someone's behavior, because a lot of that stuck patterns that we're saying we're trying to develop, a really good way of disrupting that is start reinforcing doing literally anything different, right? So that can be one way of kickstarting some change and some psychological flexibility. Another way that was really useful for me is thinking about it. Now, this is more like around clinical applications of RFT, but you can think about other functional classes that you want to get better at for yourself and you want to track and promote for your client. One would be the coherence piece, because we were saying like that's an intrinsic motivator. Things need to make sense. But the problems come when it's more about coherence based on my version of the world is the one true version. That tends to cause problems with no feedback from the world. But things making sense functionally. Like, can you remember, maybe, I think you're probably all there or getting there when you were learning about the 3-term contingency, but then you could just like see it happening, like you're like seeing how the matrix works. Like you don't need to think about it. You can just see the contingencies. So you want to shape that up in your clients too, for things to make more functional sense to them and to you in terms of how you're understanding their behavior. And the other part is helping them become more sensitive to context, the things that are going on inside and out in the world. Help them track that better, right? Would be another way of saying that. So if you can develop those skills in yourself, the noticing skills about being more context sensitive, that'll help you too, and it'll help your clients. So last thing I want to leave you with are some resources. So Dr. Johnson mentioned for ACBS joining as a student member. So that's the contextualscience.org. I would highly recommend doing that if you want to have like a really low response effort thing you could do that would help your ACT interest journey. Highly recommend. It's value-based dues, and the suggested dues for a student for a year membership, I checked before hopping on today, is $35. So I know I was a grad student once, $35 is not nothing, okay? Not saying it's not nothing, but when it comes to like, joining NASP or something like that, I think student membership is even more than that for NASP, but maybe I'm wrong. I could be wrong about that, but either way, great resource. If you can do it, highly would recommend it. There's a lot of really good online trainings these days. There aren't any I know of that I would specifically not recommend, but the reason I put Praxis up there as one to check out is because when you buy one, you have lifetime access. Other ones, when you might buy it, you have like limited access for a few months. So I think Praxis is a great place to check out. There is like a really recent one on the DNAV model. So if you're interested in DNAV and that resonated with you, that could be a great thing to check out for an online self-guided training. A lot of people, myself included, start with Act Made Simple as their first book. Get it through the university library or something. Check it out. Again, it's very good. If I could go back and start over, the place that I would start, the very best intro to ACT textbook I think is out there, is Mindfulness for Two. So I would highly encourage you to check that one out. A Liberated Mind, I think I mentioned that at another point. One thing that's cool about that is all the intrinsic motivations and pivot ideas that Steve Hayes put in there. And the first half is framing out the ACT model. And the other cool thing about that book is the second half is basically all exercises for you to do. So it'd be a way of learning about ACT and kind of practicing and exploring it related to your own experience. And then even deeper dive into that is that workbook, that self-practice, self-reflection workbook around ACT. You can work together as a cohort even, or you can work individually through it. But this way of doing it, and again, ACT is a great model for this, is being able to apply, like learn about ACT by experiencing it for yourself. Gives a much more personal feel to applying it with your clients. I'll pause there. Again, I have time for questions or comments, if there are any.
I didn't know if through private practice or otherwise you could talk real briefly about when it might be contraindicated to use any of the models specifically or just generally.
That's a great question. Contraindicated. I think it might be more like, if you can't see that experiential avoidance pattern as being like the front and center issue for your client, you just might not need ACT for it to be helpful. Like if you think about someone that's a client that is not having those acceptance diffusion barriers, like that drive their behavioral avoidance, if they seem really ready and open and willing to do it, they just need skills, right? Or they just need some environmental modifications to support their performance. I'm not so sure the ACT is going to add much to what you already know. But if you're starting to see that experiential avoidance piece being, when you do your case formulation, as being a really strong signal, right? That's when I would say it's indicated. If there is one place I would say maybe not, would be when it's anything around really intense distress and emotion dysregulation or suicidal ideation. That's maybe not the best time to pull out the mindfulness activity, right? DNAV skills are not going to get taught when someone's in that state of regulation. you need to use probably interventions that are specific for those really high intensity, high risk scenarios. So I'd be thinking more about CBT for suicide or DBT, distress tolerance skills, and moments like that. That's a great question, though.
Thank you.
What else?
I like the Kidflex model for like,
It's cool, isn't it? Yeah. What resonates with you about that, Elise?
well, when you were going with the models, I was just thinking about like how we can adjust it for younger ages, and then you went to that slide. So it kind of answered my question while I was thinking about it, which is ways that you can adapt it to a wide variety of ages in schools. I like how simple it is.
Yeah. Yeah, totally. And like a lot of things when you're trying to teach something, one of the ways that kids hate to learn the most is when you like sit them down like we're learning right now and do death by PowerPoint. Like we can tolerate it as adults for the most part, but it's not, I would much rather be with you for like 2 days and be able to walk all this stuff out. But you can, the Kidflex too, I think lends itself pretty well to, you can just start using that language, right? You don't necessarily have to sit down and teach them the Kidflex in order to start using that language when you're making that read about what might be helpful. What else? Okay. Well, it was awesome to be able to be with you today. Thanks for hanging with me and the technical difficulties. I was telling Dr. Johnson at the beginning, I was really scared because the last few days, for whatever reason, my wife and I have a farmstead out in the middle of nowhere. And so we have a really old farmhouse. And for some reason, there have been bees that are getting in my office window. And I thought I was going to have to pause to like take care of bees. And that didn't happen once, just a power outage. So I'm glad we could avoid that. But again, thanks so much for having me. I really hope it was useful for you. And I think I'm on the email that was sent around before. So if there's anything, you have questions, can think of anything I might be useful for, please reach out.
Thank you.
We really appreciate you coming. I think there's going to be some more conversations around this. We do have some ACT materials in the resource room in our clinic, but I'm going through the CBS website, and there's actually quite a number of protocols for children. I'm typically on the measurement side. And so I was just looking at some of the ones that were there, but if any of you want to potentially have this as something that we might read together next semester, or anybody on Zoom would like to have a book club, maybe an hour, once a month after, if this is something that interests you. This is not mandated. So students, do not feel like this is going to be a mandate. This is not a mandate. But if you're interested in doing something like that, I think it would be super amazing to do if this is kind of where you want to go on your journey. So anyway, it's given me a lot to think about, as you and I have discussed before. And of course, I'm, thinking about some other things as far as theoretically, but I really appreciate it. It was amazing for you to come and spend this much time with us today.
My pleasure. Thank you so much.
I'm going to stop recording.
Okay.